Hey everyone, welcome back. We're diving into a measles outbreak today,
Yeah.
happening right now in Texas and New Mexico.
Right.
And we're looking at this AccuWeather article
Okay.
called Texas Measles Outbreak Grows as Cases Appear in New Mexico.
Sounds pretty serious.
It is, and we're going to look at why this outbreak is
Yeah.
so notable, what the impact is,
Mm.
and what it might tell us about
Yeah.
vaccination trends.
Yeah. No measles is nothing to mess around with, that's for sure.
Right, and this outbreak is already pretty big, 48 cases in West Texas.
Wow.
Most of those are in Gaines County.
Gaines County, how big is that?
Just over 21,000 people.
Oh, wow. So a lot of cases in a pretty small area.
Exactly. It shows how fast measles can spread.
Especially if vaccination rates are low.
And that's what the article says. All the cases so far
Mm-hmm.
are in people who either weren't vaccinated or we don't know their vaccination status.
That's the thing about the measles vaccine. It's
The MMR vaccine.
right. The MMR, it's super effective.
How effective are we talking?
Oh, like 97% after both doses.
Wow, 97%. That's amazing.
It is. And that plays a big role in herd immunity.
Herd immunity. Now, that's something I've heard a lot, but
Right.
what does that actually mean?
So basically, when a lot of people are immune to a disease
Okay.
through vaccination or because they've had it before, it creates a barrier that makes it harder for that disease to spread.
So it protects everyone, even those who can't get vaccinated.
Exactly. Especially important for a disease like measles that spreads so easily.
Right, and the article points out that most of the cases
Okay.
are in people between 5 and 17 years old.
Interesting. Why that age group? I wonder.
I was wondering that too.
Well, they're all in school, right? Close together all the time.
Yeah.
And measles spreads through the air, so.
Makes sense.
And then there's vaccination exemptions. Some states let parents opt out.
Right, for religious or philosophical reasons.
Exactly. So if enough people aren't vaccinated, it creates a higher risk.
And it's not just about being sick. 13 of the 48 cases ended up in the hospital.
Yeah, people forget measles can be really serious.
What kind of complications are we talking about?
Pneumonia, encephalitis, even death.
That's scary.
It is. It's not just a little rash.
So how has Gaines County reacted to this? They have a lot of cases.
Well, the article says they have one of the highest rates of unvaccinated people in Texas,
Wow.
but their vaccine clinic is seeing a surge in MMR requests.
So maybe people are realizing how important vaccination is.
It could be. Sometimes it takes something like this to make people take action.
It's like a wake-up call.
Exactly.
So we've talked about the local response, but I'm curious about the national picture.
Yeah, let's look at how this outbreak fits in nationally.
Sounds good. Okay, so the article mentions that nationally there were 14 measles cases across 5 states as of February 6th.
As of February 6th. Huh, so that means
Yeah.
this outbreak in Texas and New Mexico
Mm.
is like a huge chunk of those cases.
Right, it makes you think about how this fits into the bigger picture.
Right, and think about it this way. In all of 2024, the CDC only recorded 285 cases.
For the whole year.
Yeah, across 33 different places. So,
Wow, so this outbreak could be even bigger than all of last year.
it could be. It's definitely something to keep an eye on.
It is, and it makes you think about vaccination trends
Oh, yeah, for sure.
and public health messaging.
Right, because the article says Texas and New Mexico officials are pushing vaccination.
Right, saying it's the best defense.
It is, but like we've been saying, there's a lot of hesitancy around vaccines.
There is. So what do public health officials do?
Right.
How do they communicate effectively when there's an outbreak like this?
Well, it's tough because there's just so much information out there.
Right, and not all of it's good information.
Exactly, so it's hard to cut through all the noise.
And get people to trust the right sources.
Exactly, you have to build that trust.
So how do you do that?
Well, you have to be transparent
Okay.
and address people's concerns directly.
But in a way that makes them feel heard, right?
Exactly, like you're not judging them.
So it's not just about like throwing facts at them
No, it's about having a conversation.
and understanding where they're coming from.
Exactly.
Now, I've also noticed
Yeah.
that this seems to come up with a lot of public health issues,
Oh, yeah, for sure.
not just vaccines.
It's not just measles, it's everything.
So what we're talking about here could apply to other things too.
Absolutely, like chronic diseases or healthy lifestyles.
So these communication challenges are everywhere.
They are, and we need to keep working on them.
So we've covered a lot about this outbreak,
Yeah, we have.
from the number of cases to vaccination rates to communication.
It's all connected.
What are the big things our listeners should be thinking about?
Well, I think this really shows how what we do for our own health
Okay.
affects the whole community.
Like our choices have a ripple effect,
Exactly. And it shows how important public health is.
especially when it comes to protecting everyone
Right. They're working so hard to contain this outbreak.
and educate people.
Yeah.
So as we wrap up this deep dive, I want to leave our listener with something to think about.
All right.
Knowing how well the measles vaccine works
Mm-hmm.
and how serious measles can be,
Yeah.
what responsibility do we all have to
Right.
prevent outbreaks like this?
That's the question, isn't it?
It is. Yeah, it's a tough one.
It is. It really makes you think.
How do we balance individual choices with protecting everyone?
Yeah, that's the big question.
No easy answers there.
Nope.
But I think this deep dive has given our listeners a lot to consider,
For sure. We've seen how fast measles can spread.
especially when not enough people are vaccinated.
Right. And how serious it can be.
Yeah, those complications are no joke.
They're not.
And we talked about how hard it is to get good information out there,
Yeah, communicating about health issues is tough.
especially when there's so much misinformation.
It's like a maze out there.
It is, but we have to keep trying.
We do, for everyone's sake.
So as we wrap up, I think the takeaway here
Okay.
is that we're all connected.
We are. Our health choices affect everyone.
And public health is so important,
It really is. They're the ones on the front lines.
protecting us from outbreaks like this.
And educating us.
Exactly.
So keep learning, keep asking questions.
And stay informed.
Absolutely.
I'll see you next time.
See you then.